So you spoke about treating a patient based on their physical and mental symptoms. So if I come to you with a problem, of course I'll have clarity on what my physical ailments are, or I mean, what are the pain points in my body, or where exactly the pain is. But how do you deal a patient based on his or her mental symptoms? And how will you know his psychological condition?
If the patient is not expressing his
Yes,
problems.
expressing his problem. Without expressing, how will you know? Because obviously, a patient themselves might not know what exactly is running in their body or in their mind. So, how do you deal with it?
So I'll give it to you with an example of a case. A patient was suffering from rheumatoid arthritis. The patient was hardly 22 years old. So when she first came to my clinic, she was on a wheelchair. She had deformities in her bones. Like rheumatoid arthritis is a chronic condition. Arthritis, what does it mean? It means pain in the joints. So she had this condition. And rheumatoid arthritis is an autoimmune disorder. Now, what autoimmune disorder is that there are cells in the bones, and also there are cells which are fighting the foreign bodies entering our body, like the immune system of our body. Okay, so every patient has an immune system of his or hers, and these cells attack the joints. Autoimmune, these cells attack the joints and cause destruction in the patient. So this is a destructive disease, self-destructing disease. And the patient came to us, and as I've explained in the beginning, I've taken the case in detail, like how she's suffering, from when is she suffering, and from when has this suffering started. Also, we've considered the mental aspect of the patient, we've considered the physical aspect of the patient, and also the temperament of the patient. So what we come to know is the patient was not ready to describe what pain and suffering was going on in her mind. This disease has started in the patient when she was 19 years old. Rheumatoid arthritis suddenly starts. The exact cause for rheumatoid arthritis is not known to medical science. And moreover, if a patient starts suffering from rheumatoid arthritis, what modern medicine tells is the patient has to suffer with it until death. There are life modifying drugs, there are painkillers which the patients use. So this patient was not willing to share the agony, the pain that was going on in her mind. In such cases, what we do is, what we do is, we consider the mental symptoms. Now, what we consider, from when are you suffering with this disease? Patient will say 4 years, 5 years. Did you have any tension during that point of time in life? That is what we ask. Some patients, they agree, they speak out, like, yes, I had financial problems during that time. I had a troubled marriage. Now I'm out of that marriage. I had problems in school. I was being bullied in school. I was being bullied in college. I had a death of a family member, after which I started suffering. My father passed away 5 years back, after which I encountered with this problem. So this is what generally the patients say, and we also take into consideration these symptoms. But here, as a patient was not speaking, her temperament was like that. She didn't want to reveal much about herself. So we have a book of symptoms that is called the repertory. So in repertory, what do we do is, we take whatever the patient says. The symptoms of the patient are written in the repertory in alphabetical manner. And whatever the patient conveys, we take that symptom into consideration. So here the patient was very inexpressive. So that is like her temperament, like her constitution. And we take the same rubric, inexpressive, and we get a list of remedies. So that we take into consideration. Now this inexpressive remedy must also cover the symptoms of rheumatoid arthritis. That is how we take out information. Then what we consider the dreams of the patient. Dreams of the patient. Now what this lady had, she had a very peculiar dream. So what that dream was, whenever she used to wake up, in her dream itself everything is happening, she's sleeping, she wakes up suddenly and finds herself in a sea surrounded with tigers, lions, leopards, and after that she jumps into the sea and she drowns. This was a repetitive dream that was occurring in this patient. So that we took into consideration. What we consider is rare, peculiar and uncommon symptoms.
Rare, peculiar and uncommon symptoms.
Uncommon symptoms. So now this is rare, peculiar and uncommon. This is going on in her subconscious mind. So that we take into consideration. We've also taken inexpressive symptom, which is a symptom for us. We take that also into consideration. And we take the list of symptoms which are troubling her body, that is her joints. When she is aggravated, when she is ameliorated, is hot application ameliorating the patient, cold application is ameliorating the patient, going out in open air is aggravating the patient. All this we take into consideration and we find drugs and then administer that to the patient. So that is how we take our cases.